And we have a website that people are sending ideas to. We've had the community healthcare discussions. So there are a number of different ways that we are trying to engage you and get your opinions. What I'd like to know is, what is the most important message you think legislators, the congressmen here, their colleagues, senators, need to hear from the American people about health care? I mean, when I was traveling around for the campaign, over and over, people would say, how do we get this done? How can you make sure Congress and the President signs the bill into law in the very near future? I want to hear from you about what you think is important. Why don't we take a question here? Yeah, why don't we start? Yes. She's got a microphone right behind you. You give us your name.
Yeah, my name is Ron Hayes. Currently unemployed, but I have health insurance from my previous employer. This question involves both employed and unemployed people. And I heard this brought up during the campaign. I heard President Obama mention he wanted to do something about it, and that is the question of a pre-existing condition. I think that today's condition, knowing that people do change jobs, is going to become tomorrow's pre-existing condition. And even for insured people, this could become a problem. So my question is this a priority? And if so, how do you plan to legislate? I think the answer is more complex than just saying there's no such thing as a pre-existing condition. So that's important to me.
Right, no, absolutely, you're right. One of the things the President spoke about on the campaign trail was the importance of making sure that as we reform our healthcare system, that we don't do it on the backs of people who already have a healthcare condition. I mean, unless we all plan to be young and healthy forever, I mean, pretty much everyone in the room is going to have some kind of healthcare condition, and if you can't take your healthcare with you, as you're moving from job to job, and if we don't make sure that insurers aren't able to cast people aside because you've got a chronic heart disease, or you've got diabetes, or your child has asthma, then we aren't going to be able to bring everyone into the healthcare system, which ultimately makes sure that we're able to drive down costs. So that's one of the values, one of the principles that the President takes into this healthcare conversation. I mean, what he said is, I articulated a plan when I was on the campaign trail. Obviously, I thought that that was a good plan. What I want to do now is to work with Congress to make sure that we can move forward and hear their ideas, put everything on the table, and draft a plan. But that's certainly one of the principles, one of the values that he brings into that conversation. Why don't we take a question right here? Just wait a second, and here comes a microphone.
Well, thank you. Judy Robson, state senator in Wisconsin, and also a registered nurse. A couple of drivers of healthcare costs are prescription drugs. And I would love to see banning of the advertising that is targeted to patients as well as to doctors, and use that money instead for R&D. And also revise Medicare Part D to make it look like senior care that we have in Wisconsin, that not only saves money, but also provides a huge array of prescription drugs. And also lower the age for Medicare. Those that retire early for Social Security, they should automatically be enrolled in Medicare. And also some of the protectives that retire at 50 or 55, police or firefighters, let them get into Medicare. And as Wisconsin has struggled for healthcare reform, we keep on bumping into ERISA. The challenges of ERISA, trying to get around ERISA. So if we could have some loosening of the ERISA requirements so states can forge ahead, states that can't wait, that would help us tremendously. Thank you.
Great, thank you. Thank you very much. And thank you for your